My name is Rahul Varghese, and today we're going to be going over some of the primary muscles in the squat exercise. So these are going to be the main muscles, just overall that go into the exercise. So that's going to include the quadricep, this whole complex of multiple muscles, the gluteus muscles, hamstrings, the calf muscles, as well as the erector spinae and abdominal muscles. And we'll be going over each of those groups of muscles in order. So our first group is the agonist muscles for this exercise, and that just means that these are the muscles that are contracting while this exercise is happening. So that's going to be the gluteus complex, which is going to include gluteus medius, gluteus maximus, and those are going to be the main agonist muscles, as well as the quadriceps complex, which will include vastus intermedius, vastus lateralis, vastus medialis, and that whole area. So some of the synergist muscles, which just means that these are muscles that act around a joint and that help to relieve some of the stress that is placed on the agonist muscles, which is doing the bulk of the work. So they're kind of like neutralizers. That's going to include the calf muscles, gastrocnemius and soleus, the erector spinae muscles, as I was talking about earlier. It's going to run down your spine right in the back. And the hamstring muscles, so that's going to be your adductors, semimembranosus, biceps femoris, etc. So this whole hamstring area. Antagonists, these are the muscles that are lengthening during squat. So that's going to include most of our hip flexors mainly. So a little bit of the rectus femoris, psoas, and iliacus are going to be the main muscles in that group. Stabilizers are exactly what it sounds like, muscles that help stabilize the movement while it's happening. So that's going to include this whole abdominal complex, just the obliques here, rectus abdominis, this whole ab area. That's why it's important to have a belt if you're doing heavy weights, just so you can brace yourself and really get that core tight, help stabilize your lift. And that's going to be all the squat muscles.
So as for the lowering phase in the squat, hip flexion is going to be you decreasing the angle between your femur and your pelvis. And knee flexion is going to consist of you decreasing the angle between your lower leg and your femur. Ankle dorsiflexion is going to be you basically bringing the top of your foot closer to your shin. And as for the lifting phase, hip extension is going to be you using your hamstrings to extend your hip joint. And the knee extension is going to be you increasing the angle between your thigh and your shin. And basically, ankle plantar flexion is going to be using your ankles to push your heels off the ground.
Barbell squats can be very beneficial for most athletes. They help build lower body muscles, which helps with a higher vertical and the ability to produce power. They also improve core strength and posture. They improve joint stability and flexibility, and they strengthen your lower back and your knee joint. But athletes with previous injuries should check with a professional before doing barbell squats. There is an increased risk of injury if the athlete performs the exercise with incorrect form.
Regarding the form and technique for the lift, Dr. Peter Kantiana has listed the step as follows. Set your back, then set the bar approximately 1 to 3 inches below the anterior deltoid. The lifter should take a deep or lower breath, expanding the lumbar region in order to build adequate pressure. Place the feet slightly wider than the shoulders. Begin the descent with the hips rather than the knees. Then the athlete can press the ground, making sure to keep their feet planted throughout the whole lift. So some tips for the lift is to make sure to hold the breath until you've reached at least chest height or higher. To avoid your knees collapsing, imagine grabbing the ground with your feet, then screwing your knees outwards. Some of the coaching cues To look out for is to set your back, take a deep breath, down, up, re-rack. One more time, that is to set your back, take a deep breath, down, up, and re-rack.